Identification of abnormal constituents in the given urine sample. This is a sample. Coming to the physical properties, the color is pale red, odor is unpleasant, reaction treatments is basic. It's a turbid sample. And coming to calculation of specific gravity, observed value in urinometer is 1.032. This urinometer is calibrated at 20 degrees centigrade. Room temperature is around 29 degrees centigrade. Coming to temperature correction, 29 minus 20 is 9. The correction factor is for every 3 degree rise in temperature, we need to add a unit of 0.001. Here it is 0.003. So the corrected specific gravity is we need to add 0.003 to the observed value of 1.032. So the corrected specific gravity is 1.035 at 29 degrees centigrade. So these are the chemical tests that are done to identify the abnormal constituents in the given urine sample. So the first test is test for reducing sugar, Benedict's test. Here there is no formation of colored precipitate, so reducing sugar is absent in this sample. Next is test for ketone bodies, Rothera's test. There is no formation of permanent pink ring at the junction of the two liquids, so ketone bodies are absent in this sample. So next is test for bile salts, Hay sulfur powder test, sulfur powder floats, so bile salts are absent in this sample. Next is test for bile pigments, Faucher's test, no formation of green color, so bile pigments are absent in this sample. Test for protein, sulfosalicylic acid test, white precipitate is formed, so proteins are present. Next is heat and acetic acid test, coagulum appears, so it indicates the presence of proteins. So what are the principles behind these two tests? Sulfosalicylic acid test principle, the protein present in the urine are precipitated by sulfosalicylic acid by neutralizing the charge on the protein. So the principle of heat and acetic acid test is, we all know albumin is a major protein excreted in proteinuria. It's a heat coagulable protein and it gets coagulated when the urine sample is heated. So the appearance there is appearance of coagulum or the turbidity, and this can be due to either excretion of proteins or phosphate. So when we add dilute acetic acid, if the coagulum persists, it is due to excretion of proteins, and if it disappears, it is due to phosphates. So the next is test for blood, benzene glacial acetic acid test. There is a formation of dark green color, so it indicates presence of blood. And the principle behind this test is, heme part of hemoglobin has peroxidase-like activity which acts on hydrogen peroxide to releasing nascent oxygen, and this nascent oxygen oxidizes benzene to give green color. How to report the sample? So the abnormal constituents present in given urine sample are proteins and. Coming to the interpretation part, when proteins are excreted in urine, the condition is known as proteinuria. The causes can be classified as pre-renal, renal, and post-renal. Coming to pre-renal causes, the pregnancy, the causes for proteinuria in pregnancy can be classified again as physiological and pathological. Physiologically is mainly because of increased glomerular filtration and reduced reabsorption, and the pathological cause is preeclampsia, condition characterized by increased blood pressure of the hypertension manifesting after 20th week of gestation along with proteinuria. So the other causes for proteinuria in pregnancy is urinary tract infection manifesting as transient proteinuria, and it can also be due to pre-existing kidney disease in the pregnant lady. So the other cause for proteinuria, pre-renal cause is congestive cardiac failure characterized by decreased renal flow. So this increases the glomerular capillary pressure, thereby increasing the permeability resulting in proteinuria. The next cause is abdominal tumor which compresses the renal vein. So this increases the glomerular capillary pressure followed by increased permeability leading to proteinuria. Coming to renal causes, glomerular proteinuria characterized by increased glomerular permeability resulting in proteinuria, mainly seen in nephrotic syndrome and acute glomerulonephritis. So the next type of proteinuria, renal proteinuria, is tubular proteinuria characterized by tubular damage resulting in reduced reabsorption of proteins seen in interstitial nephritis and acute tubular necrosis. Overflow proteinuria characterized by increased production and excretion of plasma proteins seen in multiple myeloma, and the proteins excreted are known as Benston proteins. The post-renal cause of proteinuria include urinary tract infection, trauma to urinary tract, urinary stones, strictures of urethra, benign prostatic hypertrophy, and carcinoma of bladder. So the reason is due to leakage of proteins, proteinuria seen in these post-renal causes. Coming to whenever there is excretion of blood in urine, it can be due to either hematuria or hemoglobinuria. Let us try to understand what is this hematuria and what is hemoglobinuria. So presence of erythrocytes in urine is known as hematuria, and this occurs mainly because of bleeding in urinary tract, and the causes include acute glomerulonephritis, trauma to urinary tract, stones in the renal tract, tuberculosis of the kidney, or tumor in the renal tract, and the other cause is the urinary urinary tract infection. Now, painless hematuria is seen in bladder cancer, and painful hematuria is seen mainly in renal stone and renal infection. And what is this hemoglobinuria? It is characterized by presence of free hemoglobin in the urine, and the reason is mainly because of intravascular hemolysis. And this intravascular hemolysis is seen in these conditions: malaria, sickle cell crisis, thalassemia, beta thalassemia major, incompatible blood transfusion, and it is also seen in marathon runners, also known as March hemoglobinuria, snake bite, and burns. So this was all about identification of proteinuria or the hematuria or hemoglobinuria in the given sample. So this presentation was done by Dr. Preeti, Professor of Biochemistry, JJ Medical College, Davangere.